Hey guys, Dr. A and Dr. K here at Vakani Orthodontics. Welcome back. Today we're going to discuss orthodontic treatment in general and touch on a few important topics.
We'll talk about how to choose the right orthodontist.
Well, we're really good.
Yes, we are. Vakani Orthodontics is always a great choice. We will also discuss some of the problems that require an orthodontist. And finally, we'll talk a little about using a do-it-yourself digital orthodontic company.
How do you choose the right orthodontist?
Probably one of the best ways to choose the right orthodontist for you is to ask someone you trust for a recommendation.
And it's always a good idea to ask about that recommendation from someone who has had braces. Whether it's a friend or family member, it is likely they will be more than happy to share their experience with you.
Once you have an orthodontist in mind, find out more information. Educate yourself about their education and experience. Research their background, such as what types of specialty training they have completed. Technology is important, and so is technique. Do some research on your potential offices. At Vakani Ortho, all of our offices are modern, state-of-the-art, and our techniques are the most current. We use digital photography and digital x-rays, and we also have an iTero scanning system for creating patterns of teeth that replaces taking impressions.
And cleanliness is even more important. We pride ourselves on our cleaning, personal protection equipment, and sterilization. We take your health and ours very seriously. When you are choosing an orthodontic office, visit it first. Select the place you love and you're comfortable visiting for your appointments.
Most importantly, ask questions. During the initial consultation, don't be afraid to bring a notepad and ask whatever is on your mind. That's why we're here. At Vakani Orthodontics, we believe it's important for you to understand the type of orthodontic issues you have, as well as the most effective ways to treat them.
Exactly. The more information you know about your own dental health, the better decisions you will be able to make moving forward.
That was a perfect segue, Kev. Now let's help potential patients understand what conditions such as overbite, underbite, and crossbite are, and why it's important to correct them. Orthodontic treatment solves multiple mouth issues. Some of those issues including teeth crowding, missing or extra teeth, tooth spacing, and improper bites.
Orthodontic issues are referred to as malocclusions. Malocclusions that aren't fixed can cause problems down the line, including worn enamel, tooth decay, and issues with chewing and speaking.
For example, children who suck their thumbs or fingers after age 5 have a greater chance of developing malocclusion. Children with no space between their baby teeth are at risk too. They may have problems with malocclusion when their permanent teeth come in. This is because the permanent teeth are larger and need more space.
Nice. That segue was almost as good as mine. Let's talk about crowded or crooked teeth for a minute. Not only is this an aesthetic problem, this issue makes it more difficult to clean your teeth and can lead to gingivitis, periodontal disease, and cavities. Additionally, crooked and crowded teeth prevents people from smiling or talking to people out of shame of their smile and can even lead to loss of self-confidence and depression.
A child with malocclusion has crowded or crooked teeth. He or she may also have one of these bite problems.
What is overjet?
Overjet is often confused with overbite. Basically, in overjet, the front teeth in the upper jaw stick out over the teeth in the lower jaw. This is a horizontal discrepancy between the top and bottom teeth and leads to excessive wear of enamel on your back teeth, chewing problems, and speech issues.
What is an underbite?
Then we have underbite. This occurs when the front teeth in the lower jaw stick out further than the teeth in the upper jaw. This is a horizontal discrepancy in the reverse direction of overjet and leads to excessive wear of enamel on your back teeth, chewing problems, and speech issues.
What is an open bite?
Then there's open bite. The top and bottom front teeth don't meet when the jaw is closed. This is a vertical discrepancy between the top and bottom teeth and leads to excessive wear of enamel on your back teeth, chewing problems, and speech issues.
What is a deep bite?
I'll cover deep bite, or what is traditionally known as overbite. The top teeth totally overlap the bottom front teeth. This is a vertical discrepancy in the reverse direction of an open bite and leads to excessive wear of enamel on your front teeth and damage to the gum tissue of your top and bottom teeth.
What is a crossbite?
And last but not least is crossbite, and is where the top teeth sit inside the bottom teeth. This can lead to excessive wear of enamel on your front and back teeth and perhaps contribute to TMJ problems and pain.
Should I choose a digital orthodontic company over an orthodontist?
Let's talk about this one. There are some serious concerns. Orthodontic treatment to correct your smile is a complex dental procedure that should only be performed and personally monitored by a professional.
The standard of care for orthodontic treatment requires that a dental professional perform an intraoral and extraoral exam, as well as x-rays and photographs be taken prior to treatment. These records are then examined carefully to evaluate that your teeth, gums, and bone are free of periodontal disease or other type of pathology.
And unfortunately, the DIY treatment you commonly see online or on TV ads do not look at any of this to the detriment of the patient. If you have cavities or gum disease, orthodontic treatment will only make the situation worse and cause pain and perhaps loss of teeth.
Commonly, we have patients who come in after they have used these online companies and complain that their smile looks worse than they started, and sometimes have more pain and discomfort. Additionally, they say that no one at these companies will respond to their concerns and are left to figure it out for themselves.
Then they come to us and ask us to help fix a problem that was only made worse, costing the patient twice the cost and twice the time. Let me give you a great piece of advice that my father always told me. You pay now or you pay later in life, but you should never have to pay twice.
Can they cause infections in the mouth?
And that's just gross. Since some of the DIY materials are often not sterile or medical grade, they can lead to infections of the gum and soft tissues of the mouth. Infection of the bone tissue of the jaws can also occur. The infections can lead to tooth loss, infections of the blood, and other organs and systems of the body.
Do they produce guaranteed, long-lasting results?
One initially appealing element of DIY braces or aligners is that they produce faster results than traditional braces.
I sense a butt coming.
But while they can shift teeth further and faster than regular braces, the rapid movement increases the chances that the teeth will move back into their original incorrect position after the DIY braces are removed. Moving teeth too fast can cause shortening of tooth roots and perhaps loss of that tooth. Braces overseen by an orthodontist are designed to move teeth more gradually, ensuring they will remain in their new corrected position after treatment.
Can they lead to tooth loss?
Moving teeth too fast can cause shortening of tooth roots and perhaps loss of that tooth. The online company has not seen an x-ray to make sure the roots of your teeth and bone in your jaws are healthy. Since you are not being monitored by an orthodontist, you will never know if there is damage being done to your teeth, gums, and underlying bone.
Then try getting a representative from the company on the phone to help you. A patient who used an online company once told me they would just give you your money back, but you cannot get your tooth back.
That guy is almost as wise as our dad. Almost.
Can they change your smile and speech?
Since an orthodontic professional isn't consulted when experimenting with DIY braces or aligners, you can't foresee the domino effect of shifting and moving teeth. While one may successfully move teeth, the movement can lead other teeth to be unintentionally moved out of proper positioning. The resulting misaligned bite can leave a patient still with a less than ideal smile and possibly an embarrassing speech impediment.
Can they cause mental and emotional trauma?
In an effort to cut costs and manually fix your smile by yourself, you may end up damaging your smile to the point where it is worse than before. The mental and emotional trauma of realizing your smile is damaged and worse off can lead to mood swings, depression, and anxiety over showing your smile and a disengagement from activities from others.
Can they cost more than what you initially saved?
The idea of saving thousands of dollars is a great selling point for DIY braces and aligners. However, these braces and aligners rarely produce correct, lasting results without damage to the teeth and gums. Often, the cost of repairing the damage caused by DIY braces and aligners are more expensive than what you initially saved with them. And you know what Dad would say about that.
You pay now or you pay later in life, but you never have to pay twice.
Exactly, Kev. While traditional braces cost more upfront, they will save you much more in the long run over DIY braces and aligners by helping you get the correct treatment the first time and better avoid the repair of damages to the teeth and gums.
We hope we provided you with a comprehensive overview of orthodontic treatment in general, what to look for and hopefully what to avoid when seeking treatment.
When you come in to meet with me or Dr. K, we will sit down with you to discuss these options further and decide which is the right treatment plan for your specific needs.
Until next time, thanks for joining us, and please watch our other super informative videos to learn even more, and keep smiling.